let's go on to the transverse scans. Like I mentioned earlier, it doesn't matter where you put the probe, whether it's up here or down here or on the sides, as long as your probe is perpendicular to the midline, what you're getting are axial images or transverse images. So we are going to go through again a bunch of sections from here downwards to see what we see at each level. Now, the point of all of this is that even when you just acquire an image, you can be able to tell whether it was taken from the upper part of the abdomen or lower part. That's one. The second thing is when you're localizing masses, you want to be sure if your mass is, let's say, for example, in the pancreas. Pancreas lies oblique to the abdomen. The head is dipped down and the tail is towards the superior aspect, or it's more superior than the head. So if you saw a mass, let's say in the abdomen, and you're able to see the pancreatic head close by, that means that mass is somewhere on the lower end. If you saw a mass and you're able to tell that this mass near the tail of the pancreas, that means you're looking at the splenic hilum or the upper part of the left upper quadrant. That's how we want you to be thinking, and that's the whole purpose of all of this. It's not just to teach you the anatomy as it appears on ultrasound, but also for you to relate with the levels. If I saw this at this level, if I'm able to see such a structure, I know this is what I expect in the neighboring organs, or this is the level where we are. Even if it was a still image sent to you by a colleague and they were asking you about a certain mass or reference, you can be able to tell the level where the scan was done from by looking at the image itself and the landmarks within the image. So these are the sections we are going to go through, top to bottom. We'll start with the cadaver. And we mentioned the other day about the orientation of axial images. So you know that your right is the patient's left and the patient's left is your right. So this is right and this is left. I know for you it's the opposite, but that is how it is. So here, this is your axial image, how it will appear. This is the liver, this structure here, this brown structure. And this is the IVC going through the liver. These are the hepatic veins. This is the left, middle, right. And you have the diaphragm there, separating the abdominal cavity from the thoracic cavity. Now, some of you might be confused about this, but it's simple. The thoracic cavity or the diaphragm dips posteriorly and laterally. So, the thoracic cavity is deeper posteriorly and laterally, which means if you cut through the upper abdomen, there is a possibility that you're going to see lung tissue, and this here is lung tissue. As we go down, this amount of lung tissue is going to disappear to a point where it will be gone. I'm going to take you back to a sagittal image so that we can relate with this. I think this image is perfect, this one. So you can see this is the dome of the diaphragm. This one there, going down, all the way down up to here. Okay, this is the dome of the diaphragm. Continuing down here. What we mean by posterior recess is the fact that this diaphragm goes all the way down here. So there's this space, and this is still lung tissue. Now the first scan we are cutting through is this one where you see the black line, this one. So it means we are picking abdominal organs, right? Like the liver, but we're also picking this point of the diaphragm and this point of the lung tissue here. So if there was fluid collection within the thoracic cavity, we'll be able to pick it in this recess because it is the deepest part. So on an abdominal scan, you can be able to see pleural effusion. Let's go back to our slide. We're looking at this slide and I was saying this is lung tissue. So if you saw fluid here, This will be
Which
porephyria. Same thing on this side. This is the diaphragm there. This thin, light line, creamish, and then above it is the splenic tissue, and below it is lung tissue. Then this is your stomach, mesenteric fat, muscles of the anterior abdominal wall, and a few bones there that make up the sternal cage, the anterior ribs, muscles of the back. This is your spine, the upper body there, spinal canal, transverse process, spinous process, and then you have a subcutaneous fat and skin on the outside.
That's why they left for somewhere like 2 weeks. What did they do?
This is further down as we go towards the feet or caudally or inferiorly. This is still your liver there. This is your IVC. This is the diaphragm. And then you have the amount of lung or thoracic tissue there decreasing. This is your vertebral body. This is spinal canal. This is your diaphragm there. And a small amount, thin amount of lung tissue left. This is your spleen getting bigger as we go down. This is your stomach. And this is bowel mesenteric fat.
Maybe.
Further down, there is no more lung tissue. We have the diaphragm there. This is still your diaphragm there. This is your spleen. This is splenic hilum. This is the pancreas. Now you'll notice that we are looking at the pancreatic body and tail at this level. We are still up in the abdomen. But we're able to see pancreatic body and tail towards the splenic hilum. This is the bowel. This is your stomach, hepatic flexure. This is your gallbladder here. And you will see that the liver is getting smaller. The liver is widest towards the right side and superiorly. As we go down, it gets smaller. As we go to the left, it gets smaller. And then here, this is your caudate process, caudate lobe there. This is your IVC. Mesenteric fat, which is the yellow all around there. Muscles of the anterior abdominal wall and back. Then you have subcutaneous fat and skin. Further down, this is still your diaphragm. This is the collapsed aorta. Then we have here we have your IVC. This is the left kidney beginning to show. And then we have the spleen there, splenic flexure, stomach, hepatic flexure, a small bowel. This is pancreatic body. The neck is here, beginning to show a bit. This body, the pancreas, this is your gallbladder. And this is your liver getting smaller as we go down. Further down, your liver is getting smaller. The top of the right kidney is beginning to show, confirming the fact that the right kidney is located below the level of the left kidney. This is your left kidney. It's, fully, it's showing well. Even the internal anatomy can be appreciated. And yet here we're just seeing the top. Because of the presence of the liver, but the right kidney is pushed a little bit down compared to the level of the left kidney. This is your spleen, and this is your splenic flexure, small bowel. This is your hepatic flexure. And then this is gallbladder towards the fundus. Further down, the liver is almost gone, small amount left. You can now appreciate the internal anatomy of the right kidney. This is your left kidney. This muscle here is the psoas. Again, you will notice that the psoas is appearing at this level. That means that the psoas muscle, as we go down, pushes the lower pole of the kidney laterally or away from the midline. Because up, we never had it. Now it's coming into the picture, pushing the lower poles of the kidneys, both kidneys, away from the midline. And that's the orientation of the kidneys. The lower poles are located anteriorly and further laterally compared to the upper poles. Then these are the vessels of the left kidney, right kidney there. This is the pancreatic head at this level. Now being shown further down. Okay, confirming the fact that the pancreatic head is deep in caudally, and yet the tail is much more superior on axial scans. Then further